Hey everybody, welcome back. Today I want to talk about trying to go back a little bit to the concept of everyday counseling, how to incorporate counseling and specifically CBT, positive psychology, strengths-based therapy, solution-focused. I guess broadly these are under the rubric of the umbrella of cognitive behavioral therapy, NLP, that kind of stuff. And today I want to talk about health and fitness. I know that's a big thing in people's lives these days. They want to be active, they want to have a long life, they want to be fit for their families, for their children, for their grandchildren, and also just to have the longest, best life they can. And we also know there's the mental health benefits of fitness. And of course, for a lot of people, especially younger people, but for people of all age, there's the aesthetics. They just want to look better, and how difficult it is. And in CBT, we talk about having a routine. That there's certain behaviors and cognitive uh, views that we have on anything that we do. So the first thing is, when we're focusing on, let's say, solution focused and bringing that into everyday life, it's what is the outcome? What is the outcome that we want and why? So if you want to talk about having fitness and health, exercising, having a good diet, why? What will having that get you? So when you're looking to exercise and change your diet, it's not just about losing weight. It's what does losing weight and being fit get you? You could say a longer life. And what does longer life get you? More time with my friends and family, right? Or being healthy. What does healthy get you? I can do more things. I can be more active. I can be more outgoing. Um, what else can it get you? It can, if you're looking for a partner, if you're single and you're looking for a partner, maybe you'll be able to do more activities with them. You'll be able to attract them more. So you're kind of looking for what is the outcome that you're looking for. It's not just to lose weight, right? An analogy would be, why do you want to make a lot of money? And it's not just because you want green pieces of paper. It's what the money can get you, some security, some stability, maybe just to have nice things, right? It's not the money itself, right? It's what the money gives you, sense of security, uh, being able to travel and do things with people that you care about. What is exercise? Well, to lose weight. Again, for what purpose? To be healthier, to maybe be more active, to do certain things, to feel good about yourself, right? A healthy diet, right? So you don't feel sluggish, and right, and again, both the physical and the mental. It maybe keeps you sharp, right? You get the blood flowing, right? That's an important component of health and exercise, and we want to make sure that we're clear on why we want what we want. Then the second thing is so that's basically like the goal, the objective, the outcome, right? Then the behaviors. What are we doing or not doing to get us there? Having a routine, having it put on the calendar. And by the way, it's not about feeling like it. I don't know how many people feel good about getting up at 6 or 7 o'clock in the morning to go to work or to go to school, but you do it. I don't know how many people love brushing their teeth every morning. I mean, some people might make their mouth feel fresh, but you do it, right? We're just so used to doing it. It's a habit. We don't even think about it. And that's a good thing. So I think that we want to just kind of get into good habits, behavioral habits. The microphone here. I hope this maybe it's a little clearer, maybe a little bit louder. So we want to get into good habits, and that's having a schedule, having a calendar, whether it's a physical calendar or on our phone. It does help if we get into a routine. And I would recommend starting off small. So when I have people do cognitive behavioral therapy, for example, and they're going to do, let's say, some readings on cognitive behavioral therapy. There's some self-help books out there, or doing a thought record or a mood log. Um, I suggest that they start maybe just 10 minutes a day. Even if it's just reading one or two or three pages, never mind a chapter or even parts of a chapter. Especially if a person's a slow reader, they want to kind of really get in. Even if you just read one or two or three pages, and you take 10 minutes maybe with your morning cup of coffee here, right? Um, you want to just get into a good habit, um, and start off maybe 10, 15 minutes, 20, even 5 if you have to. Um, but it's a behavior, and it's not about feeling like it. It's about doing what you want to do because you have that goal, putting it into the calendar and making a habit, right? So every morning, with your cup of coffee, maybe as the coffee's even brewing, you do a little moon log. You do a little bit of reading. Um, Maybe when you get up in the morning, you do a little bit of exercise, even if it's running in place. Old school, jumping jacks, running in place, sit-ups, push-ups. Even if it's 5 minutes, even if it's 10 sit-ups or 10 push-ups, the goal is to get into a routine. And then, of course, there's your thoughts, right? It's the thoughts that can sabotage anything and everything. I can't do this. I don't want it. This is too hard. What's the point, right? You want to challenge that, right? You have a goal. It's not too hard, right? I can do it. It's not always easy. It's not always fun, but I can do it. I want to do it. Here's the reasons why. It's not awful and terrible, right? I can stand it. There's no reason this must be easy. In fact, very often we don't do something. We'll say, well, I don't want to exercise. It's too hard. I'd rather, I don't know. I feel like I want to go on social media. And then you go on social media and you realize after a while, I actually feel worse going on social media. Right? We think because it's easier, we get the dopamine hit. But keeping track of the things that we are doing instead, does it actually feel better or does it make us feel worse? Most often we feel better doing something rather than avoiding something. So, for example, when we procrastinate, we may feel like, I don't want to do it. I'd rather do something else. Well, very often the something else we do does not make us feel better, right? It actually, we may sometimes very often feel worse. And when we actually do the thing that we say we don't want to do, we feel better. We're done. We can scratch it off. We feel some kind of accomplishment. So we want to, again, have the goals, have the outcome. Like what is the deeper outcome? It's not just making money. It's not just losing weight. What does that get us? Health and fitness and happy and doing things, more energy, more security. What are we doing that's getting us to do that or not do it? Are we avoiding? Are we doing it? Are we putting in a calendar, having a routine, making it a habit? And then what are the thoughts that are either helping us achieve it or self-sabotaging and pushing us away? So you want to get, so for every day you want to do things, and today we're talking about fitness and health. There are many people out there. There's many on YouTube channel. There's many people that are doing health fitness videos. There's a lot of garbage out there, but there's a lot of good stuff out there too. And I would ask you to do some research. I don't want to have any particular specific recommendations. I do know that there's a lot of people out there that combine fitness and health and exercise. You have both the mental and the physical. There's nutritionists. There's a lot of influencers out there. And again, you want to be careful. But there's a lot of good information out there that are into nutrition, exercise, the physical and mental benefits. In fact, I recently came across a fitness influencer. He actually was a model at one point, and I understand he's got a PhD. Is an Italian named Pietro Bazzelli, who's a PhD. I think he's an engineer. But that's like the perfect example of mind and body. Of mental health and intellectual health, emotional health and physical health. Of course, we don't all have to do that, but again, that's just one example that there are people out there, and you can see the benefits. So I would ask you to just apply some of the cognitive behavioral techniques to exercise, to fitness, to diet, to health, and again, have your outcome, the ultimate goal, get the behaviors in place, start small baby steps, and make sure your thoughts are congruent with what you want. They're not self-sabotaging. They're bringing you forward, having a clear picture of what you want and why, and then making sure your actions and your thoughts are in sync for that. Hope this was helpful, and I'll see you next time.